Okay. Okay. I didn't know I was gonna say that. Okay. Anyway, my name is Hein, and I'm a nurse practitioner in Michigan, and I am the moderator for tonight's talk. I am also helping to host the Deaf Health Talk. This is a joint venture between MDisability, University of Michigan Family Medicine, and Partners in Deaf Health. We're hoping to get some more collaborations in the future so that we can really expand on these talks. If you would like to collaborate with us or sponsor these talks, you can go ahead and drop something in the chat. We would appreciate that. And for tonight, we have closed captioning, and then we have 2 interpreters with us as well. So we're trying to be fully accessible and fully inclusive. So our speaker tonight is Dr. Daniel Hanley. He is one of my really good friends, and he is also on the AMPHL board of directors. He is a doctor in Florida, and he practices in family medicine. He has his own clinic down there. I don't want to give away all the details because I would like Dan to introduce himself. He had a great talk tonight, and he had lots of great advice to give all of you. So what we're gonna do is we're gonna let Dan take the floor, and then at the end of his little presentation, we can take questions for Dr. Hanley. Okay? So I'm gonna go ahead and turn off my camera and give the floor to Dr. Hanley. Thank you.
Thank you, Sarah. That was quite a nice introduction. I think that thank you for everything that you've done. Thank you for all being here. And I have a lot of things I would like to discuss. Bottom line is, let me introduce myself a little bit more in some detail and why I do what I do, and we can go from there. But this is meant to be interactive. My goal is for you to be able to ask a doctor more informed questions. Because I know that being a deaf person, we tend to miss out on a lot of details and we just kind of go along with the flow. But you are your own best advocate. You should be able to answer questions and expect to get the answers that you deserve. So hopefully this will help you get started on that front. Okay? So before we get started, yes, I am based in Southwest Florida, specifically in Lee County. Today is actually the 1-year anniversary of Hurricane Ian. So it's a significant day down here. Okay, who am I? So I am in primary care. Specifically, I am board certified in family medicine, and I've been practicing medicine for the past 6 years. I graduated from Loyola University in Chicago. That's how I met Sarah, and it's a wonderful place to be. I also did my MBA through University of North Carolina in Chapel Hill, and my other master's through Johns Hopkins. But that's in the past. What matters is in the future. Okay, my core philosophy is, when I see a patient, I'm always talking about the main things that people should expect from me. The first and most important thing to expect from me is the proof is in the pudding. The results are the only thing that matters. And being a deaf person in the hearing world, you know as well as I do that pretty much all anybody cares about is results. It doesn't always matter why, it doesn't always matter how, but things need to get done. You are my boss. And what that means is, even though you are coming to me for my background, ultimately, I hold myself responsible to you. In general, I treat people the way I would want to be treated. I think that's fair, reasonable. Why not? Most things in general, honestly, they require some common sense. Being practical, logical, that's how you get things done. There is two separate type of things that may be going on when people come to me. One is perception. Perception is reality. How you perceive the world around you affects how you live your life. However, perspective is happiness. So even though you may perceive the world in a bit of a different way than other people, Your perspective is how you gain satisfaction from living the best life that you can live. The goal of medicine, and I love medicine, I'm going to get into that, but the goal of medicine, whenever possible, is to get you off medication. So on this front, I'm not a very common doctor in the sense that I don't love prescribing, but I also love de-prescribing. And that matters because why take medicines if you don't always need to? Okay? So, where are you? You have to have some sort of baseline. Generally speaking, most people are relatively neutral, meaning that they're not always too happy, they're not always too sad. They're not always in pain. There's a lot of things that people experience in life, but for the general purpose of existing, we're relatively neutral. However, if you are unhappy, why is that? That's something that we can adjust, but I always try to figure out the root causes of the problems. Because medicines help cover up the problems, it makes solving problems a bit easier. But if you have a problem, why did it happen? What can we do differently? Or are you happy? And all you really want to do is maintain what you have forever and ever. Because in general, in life, we have limitations. Everybody has their own personal limitations. Living within those constraints can still lead to a good life. And part of experience in life is figuring out what your limitations are and going with that. Lifelong goals is important, especially as a deaf person. Nothing worth doing will ever be easy. And you want to kind of try to figure out what you want out of your life, big, hairy goals, that kind of thing. And in general, like I said, you are your own best advocate. It's your life. Try to focus on the kind of goals where you have a 10-year-old self and your 80-year-old self. What would make them both happy? So when you're 80 years old, what would you want to have done when you're 10 years old? Or when you were 10 years old, what would you want to have done by the time you're 80? That kind of perspective helps to focus what you want to do with your life. Get comfortable being uncomfortable. This is how you learn. You want to try to seek out different information. And in general, if you are comfortable and you want to maintain, fine, no problem. But if you are not happy, that's the time to be uncomfortable. So I'm going to talk about a couple of reversible medical conditions. There's quite a few things that are reversible, and this is another area in which I disagree with some doctors. Diagnoses can follow people for a long time, but it doesn't mean that it's incurable. And in particular, obesity, blood pressure, diabetes, anxiety, blood and cholesterol, those are all reversible. They have a lot to do with lifestyle. They have a lot to do with what you eat, what you drink, what you do. We can make changes, and these smallest changes can make the biggest difference. And it pays off on the back end. Even though you may feel like you're not quite happy now, trust me, when you're 80, 90 years old, you'll be quite happy. So let's start with obesity. Think about this holistically. Obesity is usually measured in what's called BMI, body mass index, but that's not really the best way to describe obesity. I think of it more in terms of waist size. So generally speaking, if you have a large waist size, the way you lose weight, you notice that your pants are falling off. And most people are happy when they get too small for their pants. So when you think about how to manage obesity, quality of food matters. And I'm going to come back to that. That's important, but also portion size. I don't know if any of you have ever been to other countries like European countries, but if you go there, you'll notice that their meals are our appetizers in America. And so how much we eat is just as important as what we eat. Know ahead of time what the expectations are when you try to lose weight. Your body's going to fight you. Truly. And you will feel hunger. Your metabolism will slow down. Knowing that, knowing what to expect, will lead to longer term changes because think of it like you're training your body. It goes a long way. Do things that you like. Obviously, if you're on a diet or if you're doing an exercise routine, you hate it, you're not going to stick with it. And the way I describe it is I used to run cross country and track. I don't like running, so I'm not going to keep doing it. I just do other things. My point is, do stuff that you like. All you really need to do is stay active, move around, whatever you want to do. Don't focus on diet alone. And like I said, I'm going to come back to that, but try to focus on your overall lifestyle, managing stress, getting a good night's sleep, that kind of thing. Because when you're stressed out, you tend to hold on to the stress hormones, and it makes you hold on to your weight. When you don't sleep well, you can't recover that well, and that makes it even harder to lose weight. So think of obesity as a overall holistic approach, not just food and drink and exercise. The medicines that are coming out these days are amazing. I mean, I don't get very excited about medicine, but these classes of medicines are amazing. They are called GLP-1 agonists. They're things like Manjaro, Ozempic, Wegovy, Rybelsus. Usually they're for diabetes, but it's kind of like when you take every medicine that treats one condition, and the side effect is such that it's even more marketable. These medicines with diabetic patients cause them to lose so much weight that it's the equivalent of bariatric surgery without the surgery. That's why people are so excited about it. And in general, when you think about GLP-1 agonists, they really act down the part of your digestive system that controls hunger. And that's at the end of the colon. And you can activate it naturally by a diet high in whole grains or a lot of fiber. Think of things that will pass through your gut. That's what you want to focus on. But if you want to boost, these medicines are wonderful, and they are definitely worth asking your doctor about. Cost is a barrier. Prior authorizations exist, but it's worth it. Diabetes. Speaking of which, diabetes. Not many people truly know what it means. Think of diabetes as sticky blood. You can eat some cotton candy. It's not sticky in your fingers. You have to wash your hands. That's what it's like inside your blood. That's why things slow down. That's why things get clogged up. So everybody is a bit different in terms of what they are sensitive to. Certain foods cause more stickiness than other foods for different people. And for example, my father-in-law, alcohol has a lot of sugar. However, and he doesn't drink much, but he has noticed that if he has a half a beer, his sugars spike. Half a glass of white wine, sugars spike. A full glass of red wine, sugars are stable. I can't figure it out. To me, it's all alcohol. To me, it's all sugar. But for whatever reason, his body is just not that sensitive to red wine. So if he ever does drink, he does have only red wine. And he sticks with it within moderation. Everybody's different. And it's kind of up to you to figure out what you are sensitive to or what you're not. Experience is the best teacher. The main number that I worry about with diabetes is called A1C. That's a number you should ask your doctor about. And what it means is how sticky your red blood cells are. And your red blood cells are recycled in your body every 3 to 4 months. And in general, 5% of red blood cells are sticky. That's okay. 10% is bad. 10% means it's way too sticky. In between, if you're less than 7%, that's still something I want to keep an eye on, but I'm okay with that. Above 7%, we have to do something because that could become dangerous. Cholesterol. Wonderful subject. I love talking about cholesterol. Think of it like your pipes are clogged, and you get some Drano, you unclog the pipes, you resolve the problem. That's what statins do. Statins are the main cholesterol medicine. They unclog your pipes and they help clean things up. The problem is, Drano happens overnight. Statins happen over 10 years. So statins are wonderful medicines. Don't get me wrong. I love them. There's a lot of side effects that come with them, But in general, they can be life-saving and life-sustaining medications. As with any medication, there's always going to be risk and benefit. But the point is to keep your pipes clean. And I do want to mention one more thing about cholesterol. When you get your blood work, don't look at only the LDL or the triglycerides. Those are the bad types of cholesterol. Also look at HDL. That's the good cholesterol. That helps to reverse the bad cholesterol. And that's why the ratio of the total cholesterol to the good cholesterol matters, is because if you have a good balance, chances are you may never get a heart attack or a stroke. So that's why you see a lot of families who have a lot of cholesterol problems, but everybody lives into the 80s and 90s. It's because they have a lot of good cholesterol too. Blood pressure. Great topic. A lot of people worry about blood pressure. So I do want to take some time to explain what it means. Going back to the pipes, let's imagine you're in your kitchen. You're at your kitchen sink. You turn the water on. The water is rushing through the pipes. That water puts a pressure on the pipes. And that's your top number. That's when the heart pumps blood into your blood vessels. And that can be variable in terms of how much water you have in there, how fast it's going, that kind of thing. Now, let's say you turn the water off. No more water in the pipes. That's the bottom number. That's your heart in between beats. So the pipes still have some sort of baseline pressure, but that's why it's a little bit different. So you look at the top number with the water in the pipes, and the bottom number where there's no water in the pipes. And it matters because what you want is a lot of reserve. Meaning that if your pipes break in your kitchen, you call the plumber. Your pipes break in your body, you go to the hospital. However, the magic number tends to be, say, 150 over 90 or less. Usually, I would like 130 over 80 or less. But the magic number is 150 over 90 because in general, above that pressure, your pipes can break. Below that pressure, usually you're okay. But what you want to do is build that reserve in case you do have some sort of stress for whatever reason. You want to be able to physically handle it. So that's why some people need blood pressure medicine, is to help them keep their reserve to where they would like to be. Anxiety. Huge topic and difficult. Anxiety tends to take time because people don't always know why they're anxious, and it takes time to talk through it. It's worth it. Hold on. I'll be also. Sorry, that was my family. Okay. So the way I approach anxiety is this is a matter of perspective. Life is stressful. You can't control life. Truly. All you can control is your response to that. And when you recognize what you can't control and what you can control, anytime when you are stressed out, try to focus on what you can control. If you could fix a problem, do it. If you can't solve the problem, why worry about it? Nothing you could do about it in that moment. When you think about that day in, day out, and when you're stressed out, can I fix this? Can I not? That at least simplifies your decision making. It helps you to focus on what truly matters in that moment. Prioritize. I mean, you can't control everything in that moment. Control what is the most important thing. Work your way down that list of priorities. So let me give you some example, especially in Florida. Climate change, politics, all these things that are they can be stressful because they can affect you long term. They may affect you tomorrow. Who knows? But if today you can't do anything about it, you have to pay your bills, you have to make your dinner, you have to fold your clothes, you have all these things that you have to do. Why worry about the state of the politics? Why worry about global warming? It's important. It truly is, but not in that moment. And when you kind of gain that perspective, and you can fix what you can fix, you let go of it you can't control, it helps your body. And when you think about it this way, you have three minds. You have your conscious, like you and me right now. You have your subconscious, which is where you dream, you're thinking to yourself at night, and you have your gut mind. Think of your gut mind as a primitive being. It only knows emotions. It only knows how you feel. So when you kind of settle down your mind, you may find that a lot of digestive issues that you may experience, whether it's heartburn, irritable bowel, cramping, that kind of thing, it goes away. And in general, when you approach your life, think in terms of building up your reserve. Try to eliminate anything that's pro-inflammatory. Pro-inflammatory foods, for example, a lot of salts, sugars, even glutens. Glutens are in wheat. Thank you for that, Sarah. Glutens are in wheat. Think of wheats like delicious stuff. Pasta, pizza, etc. A lot of people, when they are stressed out, tend to become even more sensitive than usual to these pro-inflammatory foods and drinks. So when you're stressed out, where you're obese, where you have high blood pressure problems, things like that, try to focus on what you eat and try to get rid of the delicious stuff for the time being and focus more on the anti-inflammatories. That's the lean meats. That's a lot of vegetables. That's a lot of whole foods, that kind of thing. And try to be relatively neutral on a day-to-day basis because it gives you that reserve to be stressed out, whether it's a happy stress, a sad stress, weddings, funerals, parties, whatever the situation may be, you can still enjoy your life, but within reason. That's pretty much what I have. And in general, I always recommend multiple opinions. I'm just one opinion. Ask your doctor, ask your family, ask your friends, because it's your life. My best advice is take charge. Do what you can within your constraints that you are given. You can still lead a great life if you think about it in that terms. Any questions? I'm here for you.
So, let me just put my camera on. Okay. I have a couple questions in the chat, so I will go ahead and just ask Dr. Hanley those questions. Let me just go back to the first one here. It looks like the first one is asking, why is lifestyle, healthy diet not addressed in medicine? So like, why don't doctors always tell us to work on activity and work on a healthy diet? Why are they always still ready to give us medication?
Great question. Short answer is time. To be able to adjust that with a patient takes a lot of time. Unfortunately, doctors are under a lot of pressure to see as many patients as they can because, put simply, they have to make money, not just for themselves, but for the system. So they kind of delegate that kind of discussion to their team members. But the thing is, that discussion is super important. And in general, I would say that if the doctor is not taking that kind of time with you, or at least having the team member take that time with you, that's something that maybe you should consider a doctor, to be honest. Because most doctors won't take that time for that reason. They just want to make the money. I hate to say that, but it's true.
Okay, I'm gonna let the interpreter switch. Okay. The next question is, what are some examples of specific lifestyle changes that you can make, such as new routines or new diet, etc.?
Okay. Also a good question. Typically, let me give you my kind of approach, and maybe that might help give you at least one example. I don't really do intermittent fasting, but it is a good approach. What that means is you kind of separate out time in the day where you could eat. Not to drink, you can drink anytime you want. But as far as food, I have a routine where typically I eat lunch between 12 and 1. I don't really have a breakfast. I drink some coffee, but I'm busy. So I'm just doing my routine until 12 and 1. At that point, I know my body. If I don't eat, I'm going to get a little hungry. I'm going to get a little irritable. And so I need to eat. I don't have a lot to eat. I just need some substantial protein, that kind of thing, vegetables, maybe some base like a rice or something. And I just eat enough where I can move on. The next time I pretty much eat it could be between 6 or 7 o'clock. Maybe I have a little snack in between, some celery or whatnot, but usually I have a pretty big meal in the evenings. And that's me personally because I'm in the maintenance mode. I'm going to come back to that. I'm I don't really eat snacks a lot afterwards. Maybe I have a little cereal, but I don't really have a lot of desserts. I try to reserve thick, rich foods for parties or going out, special occasions. But on a routine basis, I don't really eat that much. If you're trying to lose weight, the opposite is true. You want to eat your biggest meal at lunch or at breakfast. Breakfast is the most important meal of the day because that is what gives you energy to carry forward through the day. Whereas the meals, if they're too big, what are you doing after dinner? Nothing. How do you burn that off? And so it kind of is a vicious cycle. So if you're trying to lose weight and you want to get that discipline, know that there will be an adjustment period. You're learning about it. Your body is learning your routine as well. Try to focus on eating what you need to eat in the mornings or around lunchtime. Know that you might feel a little bit hungry. Ignore it. It goes away. If you're hungry, irritable, eat something. Do something about that. But if it's just a nagging, gnawing hunger, go with that. And then eat again at around dinner time. Most of the time, I eat lean meats. I don't really like beefy foods. I don't really like pork. Just because the fat content makes my stomach a little upset. I like a lot of chicken. I like turkey. Sometimes I have some fish, tofu, that kind of thing. I like risotto. I like quinoa. I like whole grains. I like rice. Um, a lot of vegetables. I love vegetables. Whole fruits. I love blackberries. My point is, try to think about shopping on the outside part of the supermarket, not so much the inside part. The inside part has a lot of processed foods, a lot of breads, a lot of pasta. Stay away from that. Focus on simple, delicious foods that you enjoy and let your body do the work. Give it some time. It could take weeks, it could take months, but you'll see for yourself how you feel. And when your clothes start becoming loose, that's a good thing.
Okay. The next question is, how do you raise your HDL or your good cholesterol? How can you make that better?
Nuts. Not too much. You don't want to eat too much nuts. But the nuts, whole grains, seeds, those are kind of add-ons to your diet that help you boost up your good cholesterol. If you want to get rid of the bad cholesterol, that's where fiber comes into play. So think of it this way. Think of cholesterol like grease. And you have a grease spill on your counter, you get some paper towels, you rub it up, you throw it up. That's fiber. Fiber soaks up the grease in your gut and helps you poop out the cholesterol, such that you force the cholesterol from your bloodstream further into the gut. So when you increase your good cholesterol with the addition of nuts, seeds, whole grains, and you increase your fiber to get rid of the bad cholesterol, that ratio jumps and you'll feel better. So my favorite nuts, I like almonds, I like pistachios, I like macadamia nuts. I don't really like cashews. Cashews are not my favorite, but everybody has their own different preference.
Okay. The next question is asking, so are there specific ways that you can reverse diabetes? Different things that you can do. So let's say you're diagnosed with diabetes, so how can you try to bring that A1C down and maybe not be diabetic anymore?
Get rid of carbs. Basically, carbohydrates are sugar. Don't get confused with complex carbohydrates. Complex carbohydrates are the whole grains. That's the stuff with seeds, the shells, that kind of thing. It's still technically carbohydrates. They're not the problem. The thing is, the complex carbohydrates take longer for your body to absorb them. That's why they're good for you. So the sugar is more consistent. The simple carbohydrates are the ones that make a sugar spike. Think of simple carbohydrates as pasta, breads, anything kind of processed, and it's super easy for your body to absorb. Most of the time, your body absorbs simple carbohydrates in your stomach in the first part of the intestine. We call those empty calories. That's why you can eat a whole bag of popcorn and still feel hungry. Get rid of that. No more carbohydrates. And obviously, don't eat too much ice cream or anything with sugar. But carbohydrates have a lot of sugar. So, like for example, potatoes, French fries, sugar. If you're going to have potatoes, at least have the sweet potatoes. So it's something that's a little bit more nutritious.
So since we're talking about diet, can you tell us what your thoughts about the keto diet are?
I do not like the keto diet, like at all. That's a horrible diet. Nobody likes the keto diet. People do the keto diet, they lose weight, but their cholesterol spike and they have a heart attack. What's the point? Don't think of diets. I'm sorry, I don't mean to be animated, but don't think of it in terms of diets. Diets imply temporary. Think of it in terms of lifestyle. You're changing your lifestyle. So when you shift your perspective towards a long-term goal of eating what you like to eat, doing what you like to do, that shifts the focus from a diet to a more natural, balanced approach. So keto diets are basically no carbohydrates, it's all meat and fats. But the fats are bad fats.
So we're gonna shift away from the diet, and so the question is asking about the anxiety. So you were talking about anxiety. Did you have any strategies? So if someone's having like a panic attack or they're very anxious, how would they ground themselves to kind of bring them down so that they're not feeling so anxious?
Great question. First is to kind of take a mental step back. If you're in the moment, you're having an acute stress attack. Why? What's going on? Let me give you an example, a great example actually. COVID. And people got panic attacks just walking to the supermarket. If they saw one person unmasked during the pandemic, they freaked out. They thought they were about to die. So when you're in that situation, ask yourself, can I fix this? Can I not fix it? What is going on? Let me give you my personal example. A couple of weeks ago, I had an emergency. Patient was in my clinic. I was doing suture removal. He passed out, and his heart rate dropped to the point where he caught it. That was a full-blown emergency. I had an AEG. I had to do CPR. My nurse was calling 911. It was a whole thing. And in that moment, what could I do? Am I going to flap my wings, fly around the waiting room, say, oh my God, or am I going to get stuff done? So in that moment, what I was thinking about, okay, what's going on? Don't do anything. Wait 5 seconds, wait 10 seconds, whatever. Ask yourself, what's going on? What can I do? The next step is do CPR. Or if you're in that supermarket and you're having a panic attack, walk out. Get your bearings, get back to a neutral state. Panic attacks is your body's way of telling you something is wrong. It is incumbent upon you to figure out why something is wrong and what you can do about it. Because if you don't get control of it and use that experience to get stronger, these panic attacks will run your life.
So I have a question that connects diet and anxiety. So do you know of any connection between what you eat and anxiety? Have you seen any research about that?
Well, yes. Do you remember when I was talking about these pro-inflammatory foods? Remember, life is stressful. You only have so much resilience. You only have so much reserve. And you can only handle so much at one moment. So when you're stressed out, the key is to get back into a neutral state however you can, to build up your reserve. So when you're stressed out and you're eating things with sugar, salt, glutens, that increases your natural body stress level, you're going to feel even more anxious. When you add that on top of other stressful situations, whether it's a bad time at work or school, whether it's a family problem, there's a lot of stress on your body. And like I said, you can only handle so much. So when you connect what you eat and get rid of the pro-inflammatory foods and focus more on the anti-inflammatory foods, that helps to bring your stress level down and builds up your reserve. When you deal with stressful situations at work, and you focus on what you can control, and you block out what you can't control, or change jobs, that helps with your stress level. Your family can't do anything about your family, but you can control your response to that family. So either you do something about it or you say no. Saying no. It's okay to say no. It's not being selfish. Think of it like you're in an airplane. Your plane's crashing, you have the oxygen mask. Who's getting the oxygen mask first? You. That way you can help other people. But if you're stressed out, your body is shutting down. How can you help other people? So it's not being selfish at all. It's an evolutionary response. So when you are stressed out, listen to yourself. Focus on what you eat, what you drink, your activities. Do what you need to do to decompress. So for me, I'm an introvert. I'm in the people business because I work in healthcare. But at the end of every day, when I come home, I want to do nothing. For a half hour, I just want to watch some TV, chill, that kind of thing. That's my routine. Other people de-stress by working out. Other people want to go out, but there's no right or wrong. It's more what you want and how you recover. By the way, Sarah, I don't mean to interrupt you, but I got a question from the Q&A. It says, not sure if you can help with this, but I am donating plasma. What do you think I should do in order to prepare for that? Drink fluids, not too much sugar, because anything other than water tends to be dehydrating, but plenty of fluids will help you. And maybe if you want to, watch some YouTube videos on what exactly is involved in a plasma draw. Because when people have never done that before and they see the needle going into the arm, they can faint, they can pass out. At least if you know what to expect, it helps you build up the resilience so that you don't pass out. Plenty of fluids.
Okay. This question is asking, when you're super anxious or you're stressed out or you're having, maybe panic attack, is it advisable to work out or do your normal exercise routine, or would that just stress out your body more?
No, if you like working out, go for it. That's a good stress. If you don't like working out and you're kind of forcing yourself to do it, don't do that either. I mean, there's no right or wrong here. Good stress is how you recover. Bad stress is the one that sucks the soul out of you. So if you want to work out, go for it. If you want to do nothing, that's okay too.
I do have a good question. You were talking about Ozempic and some of the other weight loss medications that
Mhm.
became very popular this year. What are your thoughts about that? Do you think that doctors should just be prescribing those to people that are obese or overweight, or do you think that there should be more of a whole health or holistic approach? And I'm gonna hold that thought for a minute because the interpreters need to switch. Okay, go ahead.
Thank you. I love those medicines because the weight loss medicines are traditionally prescribed like phentermine or orlistat, they're terrible. Nobody likes them. There's a lot of side effects. They don't really work that well. These medicines are game changers. I'm all in. The main side effect that people are concerned about, it's not just the cost, but the side effect is nausea and vomiting. And that's simply because when people take the medicine, they eat their usual portions, their body physically can't handle it anymore. So you kind of have to go slowly and methodically. But to answer your question, yes, go for it. Because it's not just the medicine. You're going to be using the medicines in the context of the overall holistic approach. One of the problems with obesity management is, well, it's frustrating. Losing weight is hard. And people get very upset when doctors keep saying, well, focus on what you eat, what you drink, change your exercise habits. They've done that. People know that. People have tried that, and they still can't lose weight. These medicines give you that boost, and they help you lose weight. Yeah, I mean, I love them. And the goal is for you to get to where you want to be, and then the goal is to get you off medicine. And that would be incumbent upon you to maintain the gains that you've made. And if worst case scenario, and you have to go back on them in the future, okay. But I'd rather people get the medicine, lose the weight, because it has such a downstream effect. It helps with diabetes. It helps with blood pressure. It helps with sleep apnea. It helps with cholesterol. It helps with fatty liver. It helps with heart attacks, strokes, a bunch of stuff. So why wouldn't I be on board? So I'm trying to get these medicines for my patients. I don't want to say the problem is the frustrating part. Doctors don't always want to do the prior authorization. And think of prior authorization like a game. Once you know the rules of the game, you know who the players are, you can kind of navigate the game, and the objective is to get you what you need.
So, I was talking about the whole health approach with my last question. We are in an opioid epidemic in this country, so I would like to hear your thoughts about narcotics and if you think narcotics are good for people or if they should explore other options. I realize that deaf and hard of hearing and other vulnerable populations don't always know everything that's going on in the media and with research and whatnot. So what are your thoughts about the whole opioid crisis?
It's a problem. But the bigger problem is mental health. The reason why people use narcotics is because they are trying to escape reality. Their existence is terrible. And they are in a bad situation with their families, their friends. They mentally, they're not in the right place. And so they use narcotics to try to cope with the pain, with the anxiety, with what the problems that they have. And I mean, it kind of goes hand in hand, mental health and narcotics. Uh, Narcotics are wonderful medicines, truly. They can be very, very helpful. But usually I think of them more in terms of the hospital type of approach. Like I wouldn't give certain antibiotics unless you're in the hospital. Narcotics usually tend to be for severe pain where nothing else helps. But for long-term chronic use, they're terrible. And they can really destroy your body because you become physically addicted. You will always encounter doctors that would judge you based on narcotic use. And it's one of those situations where you don't want to be dependent on something. And if you have a problem, I usually try to solve the problem a little bit differently. If you have a pain problem, well, that goes hand in hand routine, like working out or exercise to loosen up your body, trying different medications like muscle relaxants, maybe some a short burst of steroids from time to time, maybe some NSAIDs or non-steroidal anti-inflammatories like ibuprofen, Aleve. Within reason, we try to address it differently from a whole patient perspective. Drugs like narcotics are just, they're tools. They're very powerful, very effective tools. But when you think of medicine, you want the right tool for the right job at the right time. When the job is done, you put the tool away. So long-term narcotics, I try to get people off of narcotics, for sure. I'd rather people smoke marijuana than do narcotics.
Okay, I do have another question about diet. So we have a lot of questions about diet tonight. So when you're on a diet, how do you work through an increased appetite with your metabolism being lower? So let's say like you're trying to lose weight, you're trying to work out, but you don't feel like it because your metabolism is not quite there, but you're still hungry all the time. So what do you do?
That's your cravings. That's your body fighting you. So, what I would do is focus on protein. Protein fills you up. And I'm not talking about protein bars, because protein bars have a lot of that frosting, sugar stuff. Proteins like meats or even beans or chickpeas, things like that, they make you feel full faster. Whole grains also help you feel full. So if you eat a lot of whole grains are many different things, even certain rices. That will also help you feel full faster. When you eat more slowly and let your body kind of work its way through the digestion, you also feel full faster. And this kind of goes back to that etiquette where you eat something, you put your fork down, you finish chewing, then you can eat again. Go slowly. When people eat empty calories like popcorn and they eat it fast, well, that's a sugar spike. And sugar gives you energy, you do stuff, you're hungry all over again. So when you kind of shift your approach in that moment, that protein, or eat some nuts. Nuts can fill you up too. I also like some celery. Hard, cold celery, it's crunchy. It gives you something to do. It's a good snack. Carrots, vegetables in general are wonderful. Different colors.
Okay, so another, since you mentioned medical marijuana earlier, we had a question about medical marijuana and what your thoughts are for anxiety or other medical conditions. Do you think that is a good tool in medicine?
Yes. Well, I shouldn't say that. It is. Officially, I don't recommend smoking. But bottom line is, marijuana seems to have a lot of positive effects. The way I think about it is, it helps you decompress. It allows your body to relax. It absorbs the foods that you eat, and depending on what type you're using, you can either feel better in terms of more energy, or you can feel more relaxed in terms of wanting to go to bed. We're in between. And one of the reasons why I advocate for medical marijuana over, say, narcotics or benzodiazepines or stimulants is because the controlled substances could be addictive and dangerous, and you will have problems getting them. But medical marijuana, to me, is no more harmful than smoking cigarettes. It's better than alcohol, and personally, I don't really feel like uh, it should be regulated at a category with Schedule 1 type of government approach. But I do believe in the medical component of it, where if you're using it recreationally for whatever reasons, people that have a medical benefit pay less money in terms of taxes or whatnot. So there is still that beneficial approach from a medical standpoint, because anything that helps you reduce your stress tends to be a good thing.
So there's a question in the Q&A. Dr. Hanley, would you like to read that?
Yes, I saw that one. Do you have any recommendations for foods to eat during menstruation to reduce cravings and raise energy levels? Uh, that's a relatively complicated question. That's okay. So it looks like Sarah wants to start with that one. Is that right? Or no, I guess not. Okay. When women menstruate, it kind of depends on your period, how heavy it is. But I've noticed that iron tends to be a problem. So when people lose iron, too much iron, they tend to feel cold, they tend to feel fatigued and tired. They don't have the energy. So try to focus on stuff with iron. And that will also help you with cravings. Of course, protein. Iron-rich foods definitely would be liver, but nobody likes liver. There's a lot of vegetables that have a good amounts of iron in it. Potatoes with the skin, like sweet potatoes, things like that.
Okay, so the last question I have to wrap up tonight is, um, should patients come to you at the beginning or at the last resort? So like let's say they have like high blood pressure or something. So should they come when they're both worried about the situation or when they're not doing so hot? When should they come and see you, Dr. Hanley?
I would say if patients want to see me, they should just see me. Because the way I look at it, an ounce of prevention is worth more than a pound of cure. I'd rather catch small problems while they're still small before they become bigger problems. That being said, I do accept patients that have come from the hospital. They've already had a stroke, they've already had a heart attack. At that point, you're shifting gears. So they've already had a problem. Let's help them not have further problems. Or conversely, let's say you're a young person, 20s, 30s, 40s, you want to just kind of stay proactive, you should see me or your doctor, for sure.
Okay, Dr. Hanley, would you like to say any last thought before we close out tonight?
Yes, I do have one final thought. As you go about living your life, just think of it this way. Life is too short for nonsense. Life goes by so quickly. Maybe in the heat of the moment, time feels like it's going slowly, but then you wake up one day and the years and decades have gone by like that. When you look back on your life, would you rather spend your life stressing about nonsense or working towards big goals that will benefit you even when you're 80 and 90 years old?
Thank you so much, Dr. Hanley, for joining us tonight. Everybody that joined us, thank you for joining, and thank you for the interpreters and for the captioning. We appreciate that. We are gonna have our next Deaf Health Talk in November, and our partners in Deaf Health will be hosting that talk. So that should be at the end of November, I think after Thanksgiving. So that would be really exciting, but we were very excited to have Dr. Hanley today, and we hope to see him with us in the future. Thank you, and I have recorded this session, and I'm hoping to put it out on social media. Thank you, and have a good night.
Thank you for having me.